Hello, everyone. Thank you for joining us for Nutritional Considerations for PKD Patients. I'm Nicole Haar, and I will be your host throughout the webinar. We will get started with the presentation in just a moment, but first I have a few announcements. All attendees will remain muted throughout the presentation to ensure good audio quality for all viewers. We are recording this webinar and will archive the recording on our website within the next few days. If you have questions during the presentation, please type your questions into the question box located in your control panel on the right side of your screen. We will do our best to answer as many questions as possible during the Q&A session immediately following the presentation. Please note we will address questions related to the webinar topic, and if you have specific medical questions, please follow up with your healthcare team. Please note that the PKD Foundation does not offer medical advice, and the information shared during this webinar is not intended to be a substitute for consultations with your healthcare professionals. Care and treatment decisions related to your health must be made in consultation with your healthcare team. I am delighted to introduce you to our speaker, Angela Cusimano. Angela graduated from Kansas State University with her degree in nutrition and dietetics. This was followed by completing her master's in nutrition and dietetics at the University of Kansas Medical Center. For the past 4 years, she has been a renal transplant dietitian specializing in nutrition specific to kidney disease and type 2 diabetes. She became credentialed as a certified specialist in renal nutrition and as a certified clinical transplant dietitian, working over 1,000 hours in kidney specialized nutrition. Along with her involvement with the National Kidney Foundation, she is the treasurer of the Kansas City Council on Renal Nutrition for the 2021 calendar year. Angela has done presentations for the National Kidney Foundation, the Nephrology Nursing Association, and she was interviewed by the PKD Foundation for our PKD Life magazine. Welcome, Angela. We are very excited to have you here and to learn more about a healthy, kidney-friendly diet. We'll turn the presentation over to you so you can share your slides.
Okay, awesome. All right, hello. First, I have no disclosures. And I'm sorry, I'm trying to get this all figured out. Okay, there we go. I know I was already introduced, but I really like this photo of myself. So again, I'm Angela Cusimano. I'm a dietitian at the University of Kansas Health System. I graduated at Kansas State University, and then I got my master's degree at the University of Kansas Medical Center. As everyone knows, my last name is Cusimano. I'm very Italian. I grew up loving food and nutrition. My mom is a nurse, and so I have this healthy balance of good food and good nutrition. And then this is my favorite photo. I got to go to New Zealand last year, and I love alpacas, so I got to spend some time with some alpacas. Okay, so first I'm going to talk about our objectives. So first, we're going to talk about the basics of a healthy kidney diet, nutrition's role in management of chronic kidney disease, nutrition goals for each stage of chronic kidney disease, and then the benefits of the different diets. Okay, so causes of CKD, as you're all probably very familiar with. The top 2 common causes of kidney disease are type 2 diabetes and high blood pressure. That almost makes up a third of, or 2/3 of chronic kidney disease. Next is glomerular nephritis, polycystic kidney disease, and then IgA nephropathy. So statistics on PKD and nutrition. PKD affects over 600,000 Americans and 12.5 million people worldwide. And then in this presentation, I'm going to go over cyst growth related to sodium, protein, acid precursors, and water. Okay, so what are some barriers to following a kidney diet? So part of it is lack of physician's knowledge. It's really hard to know kind of what stages of kidney disease to follow and kind of specifically what patients should be following at that time. You know, we're kind of the experts in the field. Lack of data for PKD and nutrition. I did a lot of research for this presentation, and there isn't a whole lot of information out there. There's different stages of CKD and nutrition considerations. I'll go over that in this presentation, but for each stage of kidney disease, there's kind of a different diet you should be following. And then it's hard to follow diet restrictions. You know, they're complicated and they're confusing, and they're hard to follow. Okay, so ways to prevent decline in kidney function. So the main things you can do is to control your blood pressure, manage your type 2 diabetes, work on your underlying health conditions such as obesity, taking your medications, and then speaking to a dietitian about what type of diet to follow. Okay, so nutrition and CKD. When you don't have kidney disease, it's recommended that you follow a regular diet. Stages 1 through 2, it's kind of recommended that you follow the DASH diet. So it's low in sodium, good sources of fruits and vegetables, moderate amount of protein, and a plant-based diet. Stages 3 through 4, it's typically recommended that you follow a low sodium, low protein diet, and then low in potassium and phosphorus. When you're on dialysis, it's recommended to follow a low sodium diet, low potassium and phosphorus, and then high in protein. Post-transplant, to follow a heart healthy diet, moderate amounts of protein, moderate sodium, and then weight maintenance. So why follow a special diet? It can help you stay off dialysis. Studies show that following a diet really can keep you off dialysis. A healthy diet is associated with reduced mortality in chronic kidney disease. It can help prevent comorbidities such as cardiovascular disease, high blood pressure, diabetes, and obesity. And as we know, those things cause kidney disease, so preventing diseases that could increase your risk for kidney disease. And then it can also slow your glomerular filtration rate, and I'll refer to that as GFR from now on. Okay, so regular diet. So this is if your GFR is greater than 90. I typically recommend this to my healthy patients, the healthy eating plate. It's instead of the pyramid now. So you want half your plates fruits and vegetables, a fourth of your plate whole grains, and then a fourth is a healthy protein. So like I said, good source of fruits and vegetables. You want to replace your saturated fats with heart healthy fats. Your goal is to eat less than 2,000 milligrams of sodium each day. I want you to have whole grains. Dairy is 1 to 2 servings every day, and to drink lots of water. Benefits of a regular diet. It can help prevent high blood pressure. It can help with heart disease, your gut health, memory. A regular diet, healthy diet, has been shown to protect against cognitive decline and dementia. Your mental health. Diets higher in like carbohydrates or glycemic load have been related to increasing your risk of depression and fatigue. So a healthy diet can help your mental health. It can also help prevent diabetes and cancer and your risk of cancer. Okay, so PKD stages 1 through 2. So this is if your GFR is between 60 and 89. So I want you to follow a low sodium diet. High in fruits and vegetables. I want you to have good fluid intake and low sources of animal protein. If you have PKD stages 3 through 4, it's typically recommended that you follow a low potassium diet, a diet low in phosphorus, protein, sodium, and then typically it's good fluid intake unless your doctor recommends differently. If you have a GFR less than 15%, or typically if you're on dialysis, it's recommended that you follow a low sodium diet, a low potassium diet, a low phosphorus diet. When you're on dialysis, you follow a high protein diet, and then typically it's low fluid intake once you start dialysis because you stop making urine. Okay, and then post-transplant, it's recommended that you follow a heart-healthy diet. Sodium has a very large range. It's between 1 to 3 grams per day. And then protein is higher like right after transplant for the first 6 weeks. And then it's just like average. It's 1 gram per kilogram of body weight chronically. So post-transplant nutritional considerations. This is what I teach all my transplant patients. It's kind of this trifecta. So you feel better after transplant, you have no diet restrictions anymore, and usually you're put on medications that can cause weight gain. Prograf can cause fluid and weight retention, and then steroids can cause weight gain. So a complication of post-transplant, or something that could happen post-transplant, is weight gain. Glucose intolerance. Sometimes, again, those anti-rejection medications can cause high blood sugars. The steroids can cause high blood sugars. You can have high blood pressure and cardiovascular disease. I found this really interesting. So 60% of patients post-transplant have high cholesterol, and it's 70% of patients after 10 years have high cholesterol. So what to do about that? I'm a big advocate of mindful eating. So listening to your body, your hunger cues. You know, are you eating because you're bored, or you're stressed, or you're tired, or are you eating because you're hungry? If you're hungry, of course, that's fine. Cut out extra sugar. There's, you know, empty calories in sweet tea and juice and regular soda, dessert. That can really decrease your calorie intake. Limit snacks or choose healthy snack options. I'm kind of a big advocate for not snacking unless you're hungry. It's just adding extra calories to your diet that you typically don't need. And then a 500 to 700 calorie deficit. I know that sounds like a lot, but if you decrease your calorie intake by about 300 calories every day, you can lose a pound a week. And that's a very healthy amount of weight loss. And then staying active. Activity is really important post-transplant. Okay, sodium. So sodium is a mineral. It's 3.5% of the salt of the ocean is salt. It helps with nerves and muscles. It helps regulate the water content of organs. It's one of the 5 basic taste sensations. It's a flavor enhancer, which is why we use it for everything. It's used as a preservative, and I found this very shocking, but the average American consumes 10,000 milligrams of sodium every day. Okay, so sodium and high blood pressure. So what happens is you eat a diet that's high in salt, and it alters the sodium balance. More water is retained to dilute the sodium. So you eat more salt, there's more salt in your system, you have to retain more water. This leads to higher blood volume. So the more volume makes the heart and the kidney work harder. This causes stress and damage to the kidneys, and then those damaged kidneys can lose more protein in the urine. Okay, so high blood pressure and kidney disease. So again, the kidneys filter waste and extra fluid from the body via the blood vessels in the kidneys. So high blood pressure can cause the vessels to narrow, weaken, or harden. This damages the blood vessels, and they can't deliver enough blood to the kidney tissue. And then the damaged kidneys can't filter blood, regulate fluids, hormones, or acid and salt balances. Okay, so why is this important? High blood pressure is the most common manifestation of polycystic kidney disease. So most polycystic kidney disease patients likely have sodium-sensitive high blood pressure, meaning that if you actually follow a low-salt diet, this can help lower your blood pressure. Low-sodium diet has been seen to lower blood pressure and albumin in the urine. And then a diet that's less than 2,300 milligrams of sodium can lower systolic, so the top blood pressure, by 8 to 14 points in just 2 weeks. So sodium goals. So the average American, the American Heart Association recommends under 2,300 milligrams of salt every day. For stages 1 through 2, it's recommended that you consume under 2,000 milligrams of salt every day. Stages 3 through 4, it's also recommended you follow less than 2,000 milligrams of salt every day. Dialysis, it can be as low as 750 to 2,000 milligrams of salt every day. And then acute, you get a little bit more salt. It's 2 to 4 grams. And then chronic, it's under 2,300 milligrams every day. Okay, so sodium, high salt foods. So the salty six. So the salty six are breads and rolls, cold cuts and cured meats, pizza, poultry, soups, and sandwiches. So it takes 21 days to stop craving salt, and you can do this in 3 weeks. That's the goal. So for week 1, look at breads and rolls. So look for lower sodium items at the grocery store, track your sodium consumption, and then log how much sodium you've shaved from your diet. So just keeping track of how much sodium you're consuming can really make a big difference. It makes you more mindful of how much salt you're actually consuming. Okay, cutting the salt. So week 2, look at pizza and poultry. So if you eat pizza, pick 1 less cheese and meat, add veggies to your pizza, and then use fresh poultry rather than fried, canned, or processed. Week 3, soups and sandwiches. So for 1 cup of chicken noodle soup can be almost 1,000 milligrams of salt, just kind of being mindful of that. Check your labels and try low sodium options. Lower sodium meats, that's meant to say cheeses, condiments, use plenty of vegetables to build healthier sandwiches. So cutting the salt. So instead of deli meat, try fresh chicken and beef. Instead of ketchup and barbecue sauce. We really don't think about this, but condiments can be really high in sodium and add up pretty quickly. Do mustard and vinegar-based condiments. Rotisserie chicken, I love it a lot, but it's really high in salt. It's the skin of it mostly, and then a lot of chicken is pumped with saline solution. That's because Americans typically overcook our chicken, and so they pump it with extra sodium and saline solution so that when we overcook it, it stays moist. So doing baked chicken, instead of canned soups, doing homemade soups and low sodium soups, and then instead of salt, try salt-free seasonings. So 75% of the sodium we consume comes from processed foods, which is a lot. So to help with that, eat more fruits and veggies, buy no salt added versions. So when you buy canned vegetables, do the no salt added. Eat fruits and veggies as snacks instead of processed chips and crackers. Select unsalted nuts and seeds. Choose unsalted or low sodium broths and soups. Don't salt when cooking. And then learn to use spices and herbs to enhance natural flavor. This is just a salt-free seasoning that I have in one of my handouts, and it yields 1/3 cup. Okay, so potassium. Potassium is a mineral. It helps muscles contract. It helps regulate the fluid balance. It helps maintain your blood pressure, and then 90% of the daily potassium loss is via the kidneys, which is why we have to wash it when we have kidney disease. Okay, so goals for each stage. So again, when you don't have kidney disease, it's recommended, the recommended daily allowance is between 2,600 and 3,400 milligrams of potassium. So stages 1 through 2, it's the same, so 2,600 to 3,400. When you lean into stages 3 through 4, it's typically recommended that you consume less than 200 milligrams of potassium. And I found this out recently. So when urine output falls under 1 liter, follow a low potassium diet is recommended. When you're on dialysis, it's also recommended that you consume less than 2,000 milligrams, and then post-transplant is back to the recommended daily allowance. Although Prograf, one of the anti-rejection medications, can lead to high potassium, and sometimes you might have to follow a low potassium diet for just a little bit afterwards. Okay, so potassium food sources. So potatoes are the biggest source of potassium. It doesn't matter what source they are. So mashed potatoes, French fries, potato chips, they're all potassium sources. Dried fruits, this can actually really get you. So being mindful of not eating too many dried fruits. Bananas are high. Of course, everyone knows that one. Oranges, avocados, tomatoes, beans, and nuts. So lower sources of potassium. Fruits, so berries. I tell this all the time. All of the berries are really good for you. Blueberries, blackberries, strawberries, go for it. I love them. Apples, pears, peaches, and grapes. all low in potassium. Vegetables, there's a ton of vegetables as well. Green beans, all the peppers, fresh spinach versus cooked spinach that's high in potassium. Carrots, cucumbers, and onions. Meat, so fresh meat, so chicken, turkey, eggs, and shrimp, all low in potassium. And then bread, cereals, rice, and pasta. I'm doing the white bread, white rice, noodles, pasta, and then I like to say angel food cake because you got to put a dessert in there. Phosphorus. So phosphorus is also a mineral. It has many uses, which I found very interesting. So it's a plant nutrient. Phosphorus is the head of matches. It puts out forest fires, and it improves the characteristics of processed meats and cheeses. It's found in soft drinks, baking powder, and processed foods. So the recommended daily allowance for phosphorus is only 700 milligrams. So I just recommend following that for stages 1 through 2 as well. Again, when your kidney function declines and you're close to starting dialysis, limiting it to 800 to 1,000 milligrams every day. Dialysis sits under 1,000 milligrams every day. And then post-transplant, there aren't any restrictions, so I just put the recommended daily allowance. Okay, what's high in phosphorus? So all your processed foods and meats, everything's high. So sausage and bacon, all the tasty things in life. Dark sodas are high in phosphorus. So Pepsi, Coke, Dr. Pepper, nuts and legumes, those are going to be high in phosphorus. All of your dairy products, so milk and soy milk are high in phosphorus. Baking soda, so if you ever eat biscuits, so I always give the example of if you went to McDonald's and got a sausage biscuit, the sausage and the biscuit are going to be really high in phosphorus. So trying to choose something different like an English muffin or like an egg, you know, and with egg on it versus the sausage. And then whole grains, those are high in phosphorus. Foods lower in phosphorus, fresh meat, that's going to be lower because, you know, it's not processed. Garbanzo beans, so hummus, low phosphorus bean, white breads, white rice, white pasta, homemade food, so eating at home, regardless of what it is going to be lower in phosphorus than eating out. Almond milk and rice milk, again, soy milk and cow's milk is higher in phosphorus. And then light colored soda and root beer are low in phosphorus. So doing like Sprite or 7-Up, again, versus those dark sodas. So I kind of want to talk more about the absorption of phosphorus. So organic phosphorus, so natural sources such as whole grains, our GI tract only absorbs 40 to 60% of it, versus 100% of added phosphorus is absorbed in the small intestine. So such as like processed foods, dark soda, baked goods. So kind of going back to the whole grains, I do encourage you to consume whole grains until maybe starting dialysis, just because they're not going to be a very big source of phosphorus for you, and they're heart healthy and they're really good for you. So you might see white bread and white rice and white pasta versus whole grains. But again, kind of newer studies show that it's recommended to do whole grains kind of until you start dialysis. Okay, so protein. Protein is one of the 3 macronutrients. So it's fat, protein, and carbohydrates. It's used to build muscle, repair tissue, fight infections. Undigested protein converts to urea, which is a major waste product of protein breakdown, and it's nitrogenous waste. And then excessive protein intake can lead to uremic symptoms such as nausea, vomiting, fatigue, anorexia, weight loss, and muscle cramps. Okay, so animal-based proteins in chronic kidney disease, stages 1 through 4. So if you eat animal proteins, so beef, chicken, fish, it can cause hyperfiltration. So it can make the kidney work a little bit harder. It can cause oxidative stress, which leads to kidney tissue injury. It can cause increased inflammation and protein in the urine. I kind of explain this later, but when you eat animal-based proteins, it yields an acid. And if you consume plant-based proteins, it yields a base. and a low acid diet is related to a decrease in your risk of chronic kidney disease. A low protein can also lead to low sodium and lower phosphorus in your diet, which again, low sodium can lead to a decrease in your high blood pressure. And then studies show that after a meal, your renal blood flow and your GFR can increase up to 30%. After a meat meal, I'm sorry. Okay, so plant-based proteins have been shown to have a lower GFR, have been shown to lower your glomerular oh my gosh, GFR. It can help reduce urine albumin. And then again, plant-based proteins yield a base, which is better for patients with kidney disease. Okay, so protein amounts. So if you don't have kidney disease, it's 0.8 grams per kilogram a day. Just to give an example, I weigh about 140 pounds, so I would be recommended to consume 50 grams of protein every day. It's same for stages 1 through 2. 3 through 4, recent studies show to eat a little bit less than that, so 0.6 to 0.8 grams per kilogram a day. I don't want you to consume too little protein though, because that can cause muscle breakdown, and then when you lose your muscle, that can cause that can hurt your kidneys as well. So it's kind of a healthy balance of good protein sources. Dialysis, you have to eat a ton of protein. It filters it out, so it's always recommended. And then post-transplant, again, for the first 6 weeks, I want you to eat really good protein sources to help with the healing process. And then chronically, so after 6 weeks, it's just about an average amount. So as I said, I'm supposed to consume about 50 grams of protein. The average American consumes about 100 grams of protein. So we typically eat a little bit more protein than is needed. So acids and bases. So kidneys regulate the acid-base balance and replace bicarbonate. So kidneys must overwork when they're damaged. Diets high in red meat can increase the dietary acid load, and this can cause kidney tissue injury and scarring. The DASH diet, so a diet high in fruits and vegetables, low in animal protein, is associated with a 50% lower acid production than the typical diet. So again, I want to talk about specifically PKD and nutrition. I did a lot of research. There is not a lot of data on this, so I'm just quoting like the 1 or 2 studies that I found that showed a correlation. What they say is that volume of a kidney predicts the likelihood of developing renal insufficiency. So growing cysts can lead to a decline in kidney function. Related to that, fluid has been shown to help decrease the weight of the kidney, and therefore can help patients with polycystic kidney disease. So drinking lots of water is very important. So following a diet high in sodium causes an increase in urine excretion, or sodium excretion in your urine, and sodium excretion, an increase in sodium excretion has been leads to cyst growth and GFR decline. So, and I did find a lot of studies on that. Just following a low sodium diet, whether you have just chronic kidney disease or PKD, is really important and can help decrease your decline in kidney disease and cyst growth. Acid load, so consuming more animal proteins, again, leads to more urinary acid secretion. And again, the 1 or 2 studies I found that increased acid secretion could lead to increasing cyst growth. And then I wanted to put caffeine. Again, I know that I have heard that caffeine has been related to cyst growth. I couldn't find any studies on that. So coffee, go for it. Okay, popular diets and polycystic kidney disease. So the plant-based diet, what is it? It's not always vegetarian. It's heavy on fruits, vegetables, whole grains, and legumes, seeds and nuts. It's minimally processed. It's a low use of animal foods. It's a good source of fiber, vitamins and minerals, phytochemicals, and healthy fats. It helps decrease your intake of saturated fats, cholesterol, and toxins, and then it's kind of removing the processed animal products from the diet to make room for more plants. So 40% of Americans are shifting towards the plant-based diet. So again, this includes like more sources of vegetables and fruits, whole grains. It's kind of similar to the flexitarian diet. Vegetarian, again, just means that it completely removes all animal foods. The lacto-ovo is a vegetarian, but includes dairy and eggs. A pescatarian is a vegetarian, but includes seafood. And then a vegan is no source of animal products at all. Okay, what do we already know about a plant-based diet? It can help with weight loss. It can help lower your cholesterol. It improves your glycemic control and insulin resistance, so it can help if you have type 2 diabetes or if you have pre-diabetes. It can help lower your blood pressure, and it decreases your markers of inflammation, which we know can also hurt your kidneys. I found these statistics astounding. So following a plant-based diet can decrease your risk of diabetes by 74%. It can decrease your risk of prostate cancer by 35%. It can decrease your risk of colorectal cancer by 22% and all-cause mortality by 12%. Okay, so overcoming barriers. Some of the barriers could be you're unsure what to cook. There's misconceptions about getting enough nutrients following a plant-based diet, lack of cooking confidence regarding beans, whole grains, and tofu, fear the family won't like the foods being offered, and it's not kidney friendly. Okay, so how do we put this into practice? So consider what's on the table and what's not. Diversity through restriction. So consider vegetables, beans, grains you already like and don't usually consider. So an example would be, plan your menu around eggplant or around beans or Brussels sprouts. Kind of choose a vegetable or a legume that's going to, something that you're familiar with, that you already enjoy, that you can like plan your meal around. Other ideas, or just like decreasing your meat intake. So if you did like sloppy joe, you could do half red meat, and then you could do half of it like cut up mushrooms, and that way you're again getting good vegetables in, and then you're also decreasing your amount of red meat intake. Encourage one meal a day that's plant-based eating. So again, maybe choosing like lunch where you're not going to eat a meat product. Do meatless Mondays, where again you choose one day of the week where you don't do a meat product. Determine what's motivating you. That's a big one, and I talk about that again. So why are you following this diet? What is your motivation? Why do you keep following it? Why do you want to? That can really help you kind of be successful with this. Visit blogs and find plant-based recipes. There's a ton out there. I should have referenced some of them in the slides, but I don't. But if you just Google it, there's a million of them. And then plan your menu around plants instead of meats. The Mediterranean diet. So the Mediterranean diet is the best overall diet for the 4th year in a row by the U.S. News and World Report. So the diet is very similar to the plant-based diet. It's a high intake of cereals, extra virgin olive oil, fruits, leafy green vegetables, nuts and legumes, moderate intake of dairy products, red wine, fish and other meats, and then low intake of eggs and sweets. Okay, so what is the Mediterranean diet? So it's natural, so it's the ability to eat different foods each week. It's flexible, so it's natural, so it focuses on consuming minimally processed foods. Flexible, so you can eat different foods each week. It's lower in cost, so you're purchasing less refined grains, fast food, dessert, red meat, so that way, we always forget this, but potato chips are very expensive. So that's going to help lower the cost. And then a healthy lifestyle. So it recommends to exercise at least 150 minutes per week, and then taking time to eat meals with family and friends, and choosing water over soda. So this is kind of how to explain it. So for most days, there's no restrictions in the green, eating good sources of fruits and vegetables, all the whole grains, the beans, legumes, nuts and seeds, olive oil, herbs and spices. So about 3 to 4 days per week in moderation. You're consuming fish and seafood, poultry and eggs, low-fat cheeses and yogurts, and then 1 to 2 days per month, you're consuming small portions of red meat, sweets, and desserts. So I found some studies that show that the Mediterranean diet was associated with the kidney function preservation in kidney transplant recipients. And so essentially it's saying that like this is going to help, following a Mediterranean diet will help keep your kidney longer. Okay, so the beneficial effects of the Mediterranean diet. So protein intake aligns with controlled protein diet for chronic kidney disease. So the diet isn't high in protein, it's just a moderate amount of protein. The lower dietary sodium, phosphorus, and potassium. Again, you have to kind of be mindful of those fruits and vegetables, but since they're whole grains, they're going to be lower in phosphorus, kind of what I was talking about earlier. It's anti-inflammatory. Again, that's great for the kidney. It protects the vascular system. It promotes a healthy gut. It helps lower your blood pressure. And then vegetable intake exerts a beneficial effect on your GFR. So everything about this diet can help keep your kidney function from having to start dialysis and keeping a new kidney after transplant. So implementing the Mediterranean diet. First, you want to rid your pantry of highly processed foods. If possible, donate your food to a local food pantry so it doesn't go to waste. Substitute red meat for poultry and seafood, and then eat fruits instead of sweets and desserts at night. One of my favorites is blueberries with whipped cream on top. Incorporating fruits and vegetables at meal times. Season foods with herbs and spices instead of salt. Use olive oil instead of butter. And then drink water instead of soda. That's a really big one. The ketogenic diet. So the ketogenic diet, everyone is probably very familiar with this one. It's really popular right now. It's low in carbohydrate and it's high in dietary fat. So what happens is without carbohydrates, the body uses stored fat as energy, and those fat stores are called ketones. Ketones produce anti-inflammatory effects and can really help with weight loss because you're using all of your fat stores for energy. The beneficial effects of a keto diet, it's been shown initially to help children with epilepsy. It's been shown to help with cognitive function in patients with Alzheimer's disease. It's been shown to help with glucose control, weight loss, and then the slow decline of chronic kidney disease. So how to implement these changes? I want you to make SMART goals. So specific, measurable, attainable, realistic, and time-bound. I make everyone make SMART goals. So for instance, I will eat 2 fruits 3 days this week, or I will exercise 10 minutes for 4 days this week. So they're very specific, they're realistic, they're attainable, you're going to follow through with them. If it's just, you know, exercising 10 minutes a day for 3 days, that's a great start. I just want you to do something. Again, determine what's motivating you. So why do you want to follow this diet? What do you want your outcome to be? You know, why are you doing this for yourself? Make small changes. I usually recommend only making 1 to 2 changes. So instead of maybe doing the whole Mediterranean diet or the whole plant-based diet, doing like a meatless Monday, or eating red meat like 1 day less a week, or eating out 1 day less a week. So just very small changes can make a really big difference. And then take recipes that you know and love and give them a makeover. Make it comfortable, something that you enjoy already, that you know you're going to love, and make it healthier. So a quick recap. Stages 1 through 2 of kidney disease, you typically follow a low sodium and moderate protein diet. Stages 3 through 4, it's a low sodium, moderate protein, low phosphorus, and low potassium diet. Post-transplant, it is a heart healthy diet and weight maintenance. And then my diet recommendations are a plant-based diet or a Mediterranean diet. Here's my contact information. I'm happy to answer any questions that you have about diet at all. And then I'll take it away for questions.
Thank you, Angela. We appreciate all of that information. We do have some questions, but before I jump into those, if you have more questions, you can certainly continue to put them in the question box and we'll get to as many of them as we can. So the first question I have for you is about diet and managing gout. Do you have recommendations for how to manage your diet if you also have gout?
That one's a really hard one. I actually just had a patient the other day with gout and I was trying to look it up. I'm not quite familiar with it. I know it's a diet low in purine, and purine is typically found in meats and like fish. So again, doing more plant-based can be better for that. But one good thing about transplant is sometimes that can help if you have to follow a purine diet, that sometimes that can be fixed with a new kidney.
Okay, very good. So we have a couple of questions here about protein. So can you just go over again sources of protein that you recommend?
Okay, so I recommend plant-based sources mostly. So that's beans and nuts and legumes, and then like quinoa and garbanzo, all the beans. Again, they're going to be a little bit higher in potassium and phosphorus, but if you weigh the pros and cons versus consuming red meat, there's more of a benefit to it. And then moderate amount of fish and eggs and poultry, and then limit your intake of red meat. I kind of recommend with the Mediterranean diet, typically I tell people try to consume red meat less than 1 to 2 times a week.
Okay, I know there's a lot of questions out there about, plant-based and what types of proteins are the healthiest. So I think that helps to answer some of those questions. Thank you for addressing that again. What about protein-based shakes? Are those a good idea if you have kidney disease?
I think those are great. Oh yeah, sorry, I interrupted you. No, like vegan-based shakes are vegan ones. They're plant-based typically. Usually they're low in phosphorus and potassium. I really like them. I'll recommend them to patients as meal replacements. Be mindful, again, if you aren't on dialysis and that it's not too much protein. So usually I recommend using it as like a meal replacement versus adding it onto your diet. But yeah, I go for it.
Okay, and you did address this a little bit during your presentation. What do you advise patients that feel like they're losing muscle mass because they're cutting back on their protein?
Yeah, so and it is a healthy balance. I think that if you feel like you're losing muscle mass, I think a little bit more protein is okay, because a healthy amount of protein, you shouldn't be losing muscle mass. So adding a little bit more, again, doing more like beans and nuts and fresh fruits and vegetables, and then exercise. I know that you probably don't feel very good, but physical activity can really help with your muscle mass too.
Yes, definitely. So I want to go back to, oh, sorry, I lost my question. Hang on just one second. This moved. Yes, dried fruits, blueberries, cranberries. Are they all the same dried fruits? Or are some of them better for you than others?
That's a great question. I would say I would avoid all of them, just because typically they're higher in sugar as well. So they're really sweet. They're kind of extra calories. And then you're right, I don't think that they're all very high in potassium, but I would say majority of them are. So just to be mindful and avoid them as much as possible. I think if you limit it to them to about maybe 1/4 a cup serving size, that's okay. But I've had patients that have consumed like a lot of dried fruit at one time and have had like heart issues because their potassium's gotten so high.
Okay. And that's probably more concerning as kidney function declines and you're having trouble regulating all the levels of things.
That's true. I didn't think about that. After transplant, again, I don't have a problem with dried fruits. It's typically preserved with extra sugar, so it's just extra calories.
Here's a really good question. I bet a lot of people want to know the answer to this. Do you know of any apps that help to track sodium and potassium?
So my favorite app is MyFitnessPal, and that should track all the nutrients. specifically, I know for sure sodium. It should check potassium. And then, shoot, I had another one, but I can't think of it. I'm happy to look that up just because I probably need to know that, and maybe you can post it somewhere just to have resources, because I think that's a great question.
Yeah, I know there's so many apps out there. It's really hard to figure out which ones, are going to do the things that you really need specifically for your diet. I know I have loaded so many and, taken them off my phone again. So that's probably a little bit of a tricky one. Here's a good question. What about juicing? What do you think about juicing?
Yeah, great question. I have no problem with juicing. The great things about fruits and vegetables is the fiber content of them. The fiber helps keep us fuller longer, and it helps like lower your cholesterol. That's what fiber is good about. And juicing takes the fiber out of it. So again, it's not bad for you. It's still fruit. You're not adding extra, sugar to it or anything, but it kind of takes the good part of the fruit out of it, the good fiber part. So I think smoothies are better. Again, it kind of just keeps the good fiber in, which is what I like about fruits.
Gotcha. So can you talk a little bit about keto diet and protein? We have a question or a comment basically that says that they're thinking that keto diet was actually really high in protein, but according to your slides, not necessarily so. Is that correct?
No, and I know that you guys were saying that someone else is going to talk about this at your conference.
Right. We'll have more specific information about this available at the conference. Yes.
But the keto diet is high fat, it's moderate protein, and it's very low carb. So it's really not high in protein, which is very different than from the Atkins diet, which was very high protein. So yeah, it's not going to be bad if you have chronic kidney disease to follow it, because it's not high in protein. It's just like a moderate amount of protein. So really the biggest thing, is following that really high fat part of it, and then the really low carbohydrate part of it. And then protein pretty much stays the same based on a regular diet.
Yeah, and I think it would be fair to just say that if you're changing your diet, you really need to talk to your healthcare professionals about those changes, because we've talked about quite a few different ways to approach diet tonight, and everybody's different. So if you're considering changes, just make sure you go over those with the people that know you the best. So here.
Sorry to interrupt you. I keep interrupting you.
That's okay.
That one is also to be cautious of if you have diabetes, because since you're following a very low carb diet, that can mess with like any insulin that you're taking. It can cause like low blood sugars. So that one is very a diet I would definitely talk to your doctor about before starting.
Okay. Here's a really good question. So I think this is really getting at if you're trying to follow more of a plant-based diet, you're looking for things that you can eat. This question is specific to eating veggie burgers or Beyond Meat burgers. Are these really high in sodium? So is that a concern if you're eating those things?
That's a great question. They can be a little bit higher in sodium, but I think that they're okay. So kind of just looking for the ones that are a little bit lower in sodium. I know that they're I guess technically processed, but they're plant-based. And so, again, I think that the benefit of them outweighs any cons that they have. So yeah, great question. But no, Beyond Burgers and, black bean burgers and all of those are okay.
So I've kind of been saving this question because I think it's a really good one. And we may get a few more questions as you're answering this one, and we'll try to get to those too if we have time. But this question this is complicated. This is really hard. How do you keep track of all of this and measure and really, try to do a good job with your diet? How do you make it easy?
That is
that for us.
Best job security for me. So if you have one takeaway from my presentation, which I'm sure you probably know this already, but is to kind of watch your salt intake. No matter what stage of kidney disease you have, and post-transplant, watching your salt is really important. And when you watch your salt, you are tending to follow a healthier diet because things that are lower in salt are healthier for you. So I kind of mentioned this, but picking one thing. So if it's going to be like watching your salt intake, I think that's a good thing to tackle. And then when you're doing that, you're also kind of following a healthy diet while you're at it. And then again, it changes for every stage of kidney disease. And then it's a struggle while you're on dialysis, and then it's a struggle while you're like post-transplant. But I would, yeah, the big one is, I would say salt. If you were to take anything that you learned today, I'm trying to think of anything else. It is hard. And then just kind of finding one or two things to change, because it isn't possible to try everything. And I don't tell anyone to do that. Like, you don't have to make huge changes in your diet at one time, make things that are going to be realistic. So if you, do eat out a lot, and you have a family and you're really busy, make it a goal of, even if it's just eating healthier while you're eating out, like that's a good goal. So kind of finding something that you know that you can do and make a change with it.
Yeah, I like that approach, taking it one thing at a time. I think helps in a lot of different things, but particularly in a diet, because it can be overwhelming if you try to change everything at once. Can you revisit phosphorus as you get to later stages? Is the recommendation that you have more or less phosphorus as kidney function declines?
Yes, sorry. So you want less phosphorus as kidney function declines. So it's something that the kidney filters out. And so things high, I kind of mentioned this, but things high would be like dark sodas and processed foods and dairy products. I feel like dairy products are what people struggle with the most. Cheese, everyone loves cheese. It's really high in phosphorus. So like cutting cheese out of your diet, which also cuts sodium out of your diet, which really helps. But yeah, so lower amounts of phosphorus until you start dialysis, and then afterwards it doesn't matter at all. So you can follow a regular diet, you can have as much cheese as you want in moderation after transplant.
Okay. And another question just came in. How do you feel about having a glass of wine?
Oh, well, it did talk about that in the Mediterranean diet. What I tell my patients is it's all about hydration. So I don't want your kidney to be dehydrated. So for every like glass of alcohol you drink, or coffee or tea or soda, drink a glass of water with it to keep your kidney really hydrated. But as long as your doctor is okay with it, I think in moderation it's okay.
Are all cheeses the same amount of phosphorus? So are they all the same when you're considering watching your phosphorus levels?
They are not. So I'm trying to think, I can't think of the name of it right now. Starts with an A. There's one cheese that's lower in phosphorus. But that's something you can Google and look it up. But yeah, so there's a little bit less phosphorus and sodium in certain cheeses. I'm so sorry, I can't think of the name. Someone just told me about it recently, that they really liked it too. Asiago, that's the word I'm looking for. They said that they got it at Aldi's, and you you like shred it, but you can like shred it on sandwiches, and it's lower in phosphorus and it's lower in sodium.
Very good. That's good to know, especially if you really like cheese. I like Asiago cheese a lot. We will, when we post this recording, we have a page on Nutrition on our website, and we have like a chart that has foods that are high in phosphorus or high in potassium. So we'll try to get that link posted as well. And so if you have questions about specific foods, or you're trying to remember what are some of those things that have lower amounts, then maybe that will help out as well. I don't have any more questions in the chat right now, unless something comes through in the next second or two. Oh, there's one. Is there a brand of bread or a type of bread that is lower in sodium than others?
So I have heard through patients that actually white bread is lower in sodium than whole grain bread. And then a lot of my patients make homemade bread. I know that sounds like a lot of work, but it is lower in sodium because you can, determine how much sodium you add to it. So if you're really passionate about following a low sodium diet, baking it yourself. And then The brands change a lot. I know I like to reference the National Kidney Foundation. I love their website. They have lots of good recipes on the National Kidney Foundation website, and I'm pretty sure there's one about sodium as well. So I'm sure the PKD Foundation has a ton of resources, but the National Kidney Foundation has a ton of resources too, that I'll look at those all the time.
Yes, they do. They have a lot of resources. We actually have a cookbook as well, and that's available on our nutrition pages, and it's a free download. So if you're looking for some recipes, you can definitely check that out. We'll, like I said, we'll try to link to that when we post this webinar so that you have easier access to some of those resources that we have available. Angela, I just want to thank you so much for all of this information. I know that diet is so important, and patients, it's something that we can do. We can all do to help ourselves be a little healthier. So having this information is really valuable. So thank you so much for joining us and for sharing this information. We will get this posted on our website in the next few days, so that if you want to go back and review any of the information, you certainly can do that. Did want to mention before we close out that our registration is now open for our virtual PKD Connect conference. It is free to attend this year for the first time, and PKD Con will bring together patients, caregivers, healthcare providers, and researchers from the safety of your own home. This virtual event features the latest in research and treatment options, while providing opportunities to interact with speakers and participants. We hope you can join us virtually on June 25th and 26th. The PKD Foundation always appreciates the opportunity to provide you with the best possible education. After the webinar, you will receive a very brief survey. We appreciate your feedback, and we will use your responses as we develop additional resources and programs in the future. When you complete the survey, please include additional topics that you would like for us to address in future webinars. If you need to reach out to us directly with your questions, you can email us at pkdconnect@pkdcure.org, and a member of the PKD Connect team will get back to you. On behalf of everyone at the PKD Foundation, thank you for joining us, and I hope that everyone enjoys the rest of their evening.